We will be discussing about space and I, and these notes have been taken from April 23, a class from Wills by Dr. Prem S. Subramaniam. Uh, I and the vision in microgravity was the topic of that class. When the astronauts are in space, what is the main problem in the eye they face is the optic nerve swelling, and all the space scientists and NASA are working why this optic nerve swelling happens. What are the main barriers to the long space stay? The first barrier to the long space stay is radiation exposure, and the second is optic nerve swelling and the decrease in the vision. To decrease the intracranial pressure in space, intranasal use of prostaglandin analogs have been tried. Nobody has stayed in microgravity continuously for more than 16 weeks. The astronauts go to the space stations, but nobody has stayed in the microgravity for more than 16 weeks, and that also continuously. When it's not continuous, they can come to this space station, have some gravity, but continuously 16 weeks nobody has stayed. The Apollo astronauts, when they came, they come to the Earth. They have a blurred near vision because of acute presbyopia, and uh, and they have acute presbyopia, and glasses where the plus power can be changed have to be used by these astronauts when they go to space or come back. And this hyperopic shift will resolve on returning, but this depends. It is not that everybody it resolves. It can resolve, it might not resolve. Before pre-flight and after post-flight status of the astronauts, what is noted as disc swelling, papilloedema because of the increased intracranial pressure. There is a posterior globe flattening and there is a choroidal thickening. This syndrome is space astronaut syndrome is also called as VIICP, that is the vision impaired and increased intracranial pressure syndrome. In this, there is an increased CSF pressure with a partial empty cell uh, on MRI, and this is also called as neuroocular syndrome, space astronaut neuroocular syndrome, SANS. So, when we see the choroidal folds in these patients with increased intracranial pressure at space, but this pattern is different from the choroidal folds in the intracranial pressure at Earth. Because in space there is a cephalid fluid shift and a face becomes puffy. Why the face becomes puffy? Because in space, because of no gravity, there is no venous pulling at the legs. Normally, uh, normally at the head end, 70 g around 70 g of the acceleration of the earth is working, at the heart level around 100, and at the legs around 200, and the gravity is 9.8 millimeter per second square. Because in space there is a loss of hydrostatic drainage and there is no pooling of blood in the legs, the face becomes puffy. The space experiments can be have been replicated in experiments also in Germany. In Germany, what they do, they take a centrifugation machine. They take a centrifugation machine, okay, and that centrifugation machine rotates, and that centrifugation machine rotates, and that centrifugation machine rotates. That centrifugation machine makes an acceleration of about 1 g at the center of mass level, 1 g, 1 g, and this has to be done for 3 months with the person lying spine for 22 hours a day. Then only we can replicate the space experiments. There is one equation called the Davson equation. Davson equation is what is intracranial pressure. Intracranial pressure is the resistance of CSF drainage into CSF formation plus sinus sigmoid sinus pressure plus sigmoid sinus pressure. The intraocular pressure in the space flight goes very down because of the decrease in the aqueous production, but the intracranial pressure increases. Olfactory and the optic nerve. olfactory and the optic nerve around that lymphatic drainage in the space astronauts becomes very important, especially when the intracranial pressure is elevated in the space and there is loss of IOP. The the in-flight carbon dioxide levels in the space stations, the carbon dioxide mission average is around 3.56 millimeter mercury, that is 0.33%, and this is 10 times the normal sea level. The 10 times the normal sea level, because the sea level is 0.0314%. And when sleep, and if we consider the carbon dioxide levels in the sleep apnea patients, the average peak carbon dioxide level comes out to be 8.32 millimeter mercury, that is the 0.7%. In the sleep apnea patients, partial pressure of carbon dioxide increases and intracranial pressure also increases because of vasodilation. Carbon dioxide, it exacerbates the carbon dioxide challenge, that is the cephalite shift. When the ICP, there is a there is some range of carbon dioxide. When when on increasing carbon dioxide, ICP is also increasing, and then it reaches a plateau, so in these patients also there is a risk of space patients also there is a risk of high risk of renal calculi, but for that lithotripsy can be done, and for the increased intracranial pressure diamox is available. How to assess intracranial pressure in flight? It can be calculated non-invasively by spontaneously checking the spontaneous venous pulsations of the optic disc. When there is a loss of spontaneous venous pulsation, it means the intracranial pressure is more than the IOP. But this depends on the IOP character of every subject. The second non-invasive measurement of ICP is optic nerve sheath distension on the B scan. The optic nerve sheath distension, with the increased intracranial pressure, the optic nerve sheath diameter increases, and at around 60 it is around 8.5 millimeter. Optic nerve sheath diameter is also used in acute head injury before putting any ventricular drain. So to test the retest variability, but for this test there is no standard of what is normal in the group of astronauts. Optic nerve sheath diameter does not correlate with the severity of the findings. The second thing is distortion product autocaustic emissions. These are the signals from the outer hair cells, and these depend on the peri-lymph pressure. And there is no standard relationship to the intracranial pressure, and the signal to noise ratio issues are also there. But the only thing is this can be easily recorded in the space astronauts.